All right, welcome back to Western New York Living. For most people, hearing loss can occur over a period of time. It can happen because of age or maybe factors in your lifestyle and can be treated most commonly with hearing aids. But for those living with profound hearing loss, a better option might be a cochlear implant. And joining this morning to highlight this type of hearing device, Dr. Nicole Baumgartner from Hearing Evaluation Services of Buffalo and Dr. David Lafferty from Western New York Ear, Nose, and Throat. I want to thank you both for being here.
Thank you for having us.
I pronounced it right? Cochlear implant?
That's correct.
Okay, I want to make sure I got that right. Can you explain what these are, Dr. Baumgartner?
Yes, a cochlear implant is an electronic device that's implanted into the inner ear. It bypasses damaged hair cells and it directly stimulates the auditory nerve, or what we call the hearing nerve.
It sounds incredible that this can be done to help people hear. Dr. Lafferty, what is your role as a doctor to patients receiving this cochlear implant? You're the surgeon, you're putting this in?
That's correct. So Nicole and I work very closely together. I always tell patients there's two types of candidacy for cochlear implant. You have to be an audiologic candidate, meaning it's the right thing for your hearing, but you also have to ensure that medically it's safe for you to have the procedure that's required to use a cochlear implant.
Yeah, and how is it determined if it's safe for them?
So we start with a basic history, ear exam, and some imaging, either a CAT scan or an MRI, and the majority of the time, all of that is normal. Most patients who are not able to have an implant will have some history of ear disease, maybe ear surgery in the past, or they've had a condition.
How invasive is the surgery? I mean, it's going in the ear, inner ear, but people
Right.
always, they hear surgery and they think, oh my, is put me down for days? How invasive is it?
Absolutely. So the procedure itself is about an hour and a half. You're asleep while it's being performed. There's a single incision performed behind the ear. So when you wake up, you have some stitches behind your ear. You'll be a little sore for about a week or so, and then recovery is generally pretty straightforward.
All right, and Dr. Baumgartner, after you recommend this option and they go see Dr. Lafferty and get it done, how do you work with the patient after they've had the implant?
Well, about 2 to 3 weeks post-surgery, they're usually cleared by Dr. Lafferty to have the activation. And at the activation, we turn on the implant, and usually the first day, they may not be hearing speech, they might just be hearing sounds, but we walk them through that whole process. It can take them a number of weeks to months to start recognizing speech again, but I'm with them for the rest of that implant journey.
Yeah, perhaps I should have asked first, who's the ideal candidate for this device?
Well, it used to be where people had to have a profound hearing impairment in order to be a candidate. However, the candidacy regulations have opened up quite a bit. So someone can have hearing loss either worse than 60 decibels or worse than 60% word understanding. And that might make them a candidate for an evaluation, and then we perform the evaluation to determine if they are truly a candidate.
We'll tell everybody about a seminar you have coming up next Wednesday about this, but technology's changed quite a bit, hasn't it, Dr. Lafferty?
It sure has. So the initial cochlear implant was performed over 50 years ago. It was only one single channel, one way to get sound into the ear. Now people are having implants that can stimulate multiple parts of the ear to restore natural hearing. And they connect to your phone just like any other device, or they can connect to a speaker. If you go to an event, you can hand them a microphone to go through your implant. So the technology has really evolved to help people have trouble with hearing.
And I mentioned there's a seminar coming up. It's a virtual seminar, correct?
It's a virtual seminar coming up a week. Actually, it's next week.
Next Wednesday, the 10th.
Next Wednesday, the 10th. And basically, it's called When Hearing Aids Are Not Enough. So if someone has had a hearing test, has been fit with hearing aids, but they're just not finding their hearing clearly and not doing as well as they'd like to, then they might be possibly a candidate for a cochlear implant, but certainly that seminar will help them know kind of the ins and outs of the process.
And learn more about the technology, which has changed and made them a little less noticeable, I think, for the public too. If you're noticing small changes in your hearing, you should get a hearing evaluation at Hearing Evaluation Services of Buffalo. They can help with the management of any type of hearing loss. They have 4 offices located across Western New York. And to find out more about all the hearing services they offer, head to their website, hes@buffalo.org, or give them a call, 833-4488. And you're invited to attend that free online cochlear implant seminar. It's starting September 10th, starting at noon. Again, go to the website for more information on that.